I first met Deanna back in 2004, and it was an opportunity to get to know physical therapists because there was growing recognition that physical therapists were interested in treating animals and had a lot to offer. And yet, at the same time, the Colorado Practice Acts weren't available to allow, they weren't flexible enough at the time to allow for physical therapists to work um, independently, like without direct on-site supervision. So the Colorado Veterinary Medical Association asked me to help them work with physical therapists to come up with an approach that would allow the PTs to work with animals, but not have to always have a veterinarian directly providing on-site supervision. And that's when when I met Deanna, and she was one of two people that really impressed me. But um, it was a challenging time at first because this was like a situation where we were trying to navigate how do these two professional fields work together. And I was just really struck by Deanna's professionalism, her knowledge, her depth of understanding of the art of physical therapy, but also how careful and conscientious that she was just in navigating all of these issues. And then when I saw her working with dogs, I realized that that translated directly to how she approached them and their issues. And especially, we worked together directly with a case. Her name was Cece. She was a miniature dachshund, and we do have a video that we will be posting on our channel that shows that first time that Deanna and I worked together, and it was when I was still teaching at Colorado State University. And this dog had a was paraplegic after surgery, so had a hemilaminectomy and was still painful, even more non-ambulatory, and then needed a muzzle because she was so upset and distressed about what was happening to her. So her mom, realizing that surgery didn't do it, so she insisted that Cece get acupuncture and physical therapy. And with Deanna being the physical therapist of choice for me, I got it cleared through the hospital director and the head of the critical care unit, and we worked together. And I mean, it was just sweet as can be. And CC was up and moving around and dancing around, and Deanna had really innovative approaches like using a skateboard to help CC, move with different vectors and to regain her strength and the core strength. And really, Deanna became a very prominent figure in the Fort Collins rehab landscape. And she has been highly influential in building a culture of very careful and thoroughly knowledgeable veterinarians that are now working oftentimes in solo practices or small or tiny practices and mobile practices. So her influence has spread far and wide. And that was really important to me because what I didn't want to happen in the realm that I was in was that there would be this more assembly line type of approach to animal rehab where, okay, let's get these many dogs through these many exercises, and there's no time or sometimes even interest in really delving in and seeing what were the internal causes of their problems. And even animals would come to me sometimes that had been misdiagnosed or just not diagnosed by other clinics. And it's like there are certain things that you shouldn't be putting an animal through rehab, and especially that strenuous when they have like caudal cervical compression of their spinal cord. So with Curacore's rehabilitation course and certification program, I mean, those principles that I saw Deanna embody and that, come through us and our culture of really compassionate, gentle, individualized treatments, that's why we're doing what we're doing and doing it in a different fashion than you'll see in other programs. And I will come back at the end of this hour and tell you more about our animal rehab certification program for veterinarians that also is open to already certified animal physical therapists or CCRPs, CCRTs who want to learn our approach. So I'll cover that later. I just wanted to let you know my experience with Deanna and how impressed I've been from the beginning with what she does and how she approaches treatment of animals and as well as people. We've got some videos to show that. So, Deanna, here you go. Thank you for being here and doing this for us.
Oh, thanks for having me and hosting this. It's nice to see everybody, so to speak. So, what I'm going to talk with you about today is animal physical therapy for you and 6 things to consider. And my approach for this is going to be just kind of based on my personal experience. I have been practicing physical therapy since 1985. And so for 26 years, I worked with humans. And during that time, I was board certified as a geriatric physical therapist. So a lot of the work that I did in geriatrics, in working with the elderly, I think that helped me develop kind of my approach where um, I learned how to go just slow and easy, use some very gentle manual therapy techniques, for example. And those kind of things translated nicely over into the veterinary physical therapy that I do. And then I went through the University of Tennessee's canine rehab program, finished that in 2004, and then worked with a group of physical therapists as well as a consumer advocate with NARDA and the Colorado Veterinary Medical Association, the Colorado Vet Board, the governing board of physical therapy, and the Colorado chapter of the APTA. And so, a 3-year process of us all meeting together, we were trying to come up with some Practice Act changes on how physical therapists could provide rehab services to animals, but still do so safely. And so, through all of that experience, we were eventually able to change our Practice Act, which means changing a law. That was accomplished in 2007, and it enabled physical therapists meeting certain criteria to be able to work with animals. So in 2008, I officially started my mobile animal PT practice while also still continuing to work on humans. And I did both humans and animals for about 3 years and then went full time doing animals in 2011. And in the process of having more time working in veterinary physical therapy, I've had um, quite a few PTs who've been interested in animal physical therapy ask me, well, how do you do it? What all is involved? And so this webinar is particularly geared towards those kinds of questions. And so I wanted to take the time to kind of come up with a 6 point checklist of things to consider, like the Practice Act considerations, liability issues, the academic education and clinical experience needs for the training, what type of things really motivate a person to consider making this kind of change, and then the financial aspects of actually working in animal rehabilitation, and then lastly, the rewards. My hope is that in doing this webinar, I'll be able to help remove some obstacles that you might have come across in trying to even just start the process of thinking about this and really help clear a path so that you could take the time to really start looking into this, because this is an emerging field of physical therapy, tremendously rewarding. The more I know, the more I realize I don't know. So it's very stimulating professionally. And I think it's definitely worth the consideration. So we're going to be asking you some questions through this webinar, and Narda's going to help with these polling questions. And one of the first things that I was interested to know is, tell me what your profession is. So we have PT, vet tech, or other.
I'm going to close the poll and share the results. And so
Oh,
Deanna
7%.
yeah,
Yeah.
so you can see that. Yeah, if you want to go over that, that's fine.
Yeah, 7% of you are physical therapists. Shout out to you there. Most of it looks like veterinarian and other. And glad too that we have some technicians joining us. Wonderful.
Right.
The other thing that I wanted to bring up was some terminology. And you'll see here it says animal physical therapy / rehabilitation. And that's because in many states, physical therapy is a protected term. meaning you can't use that term unless a physical therapist is providing the service. So often, what we'll do in our animal rehab, veterinary rehab, is we'll call it rehabilitation or physical medicine. So you'll hear me interchanging those terms. And the other thing I wanted to just point out, for example, with these two photos here, is that with animal physical therapy, there's a huge a variety of animals to work with. I focus mostly on canine and feline rehab, although I do occasionally have some rabbits that I work with. But even, for example, in the canine field, definitely a large variety of sizes, conditions, temperaments, those kind of things. And you'll see here, for example, on the left side, here's a dachshund with some back issues that I'm working with her on her core strengthening as she's working on what we call the big blue egg. And to the right here is a little yellow Labrador, a tripod. Her name is Spree. When she was a puppy, she had to have her right forelimb amputated. She then developed some issues and significant arthritis with her left elbow and also some issues with both of her hips. So she had to have her hip joints removed. We call those FHOs, or femoral head osteotomies. And so when she would do longer distance activities, she would use a cart. And so here she is at St. Patty's Day, getting her cart all decked up here for St. Patty's Day parade. But again, just a nice variety of diagnoses and conditions to work with that, again, for me, I find really rewarding and stimulating. Things that I found helpful when I was also looking more and more into animal physical therapy were some resources. And one of the biggest ones for me is the American Physical Therapy Association. And it has within it various sections, one of them being the Academy of Orthopedic Physical Therapy. And they have a special interest group, the Animal Physical Therapy Special Interest Group, which is specifically focused on animal rehab. And it is a members only group, but they have a really good clinical practice standards physical therapy on animals document that they developed just last year. They have a great FAQ section on their website and also a membership directory. So I found it really helpful to do networking and trying to connect and visit with veterinarians in the community who were practicing rehab or interested in practicing rehab, as well as currently practicing animal physical therapists. Other resources are some educational programs in the United States. And as I mentioned earlier, I went through the University of Tennessee's canine rehab program. They have paired up with Northeast Seminars for that. And so they offer canine as well as equine animal rehab programming. Also, the Canine Rehabilitation Institute is another program. The Animal Rehab Institute, and it focuses on equine. And then, as Narda mentioned, CuraCore is developing educational programs that have an osteopathic and integrative therapy kind of approach. So my other question for you is, before I get into talking about Practice Act issues, are you familiar with your Practice Act? Yes or no?
And sharing results. There you go. 53% are. Over to you, Deanna.
And 35% aren't. So, well, that's good. Then this next section, hopefully you will find interesting. One of the things that Narda mentioned, how she and I got to first work with each other, was in the process of where we were changing our Physical Therapy Practice Act. And that was a process that we worked on from 2004 to 2007. Know that every state has different practice acts for physical therapy as well as veterinary practice acts. But particularly with regards to physical therapy, your state may or may not allow you as a physical therapist to work on animals. And if you are allowed to work on animals, it may be governed by your PT Practice Act, or it might be governed by the Veterinary Practice Act. So it's very important that you are familiar with the Practice Act of your state. so that you can know ahead of time what kind of criteria are out there in order for you to practice as an animal physical therapist. Colorado is particularly unique in the process of how we changed our Practice Act and why we did it and how it works for us today even. So I'll go over with you some of that process. So as I mentioned, Practice Acts are laws, and our PT Practice Act is Title 12, Article 285. And one of the big changes that we made in that part of our Practice Act is originally had talked about in our definitions that physical therapy was provided to humans. And so we had to change that to say patients. So that way that made it legal for us to work on animals. The other thing that it talks about is that we really have to demonstrate and have the skills and knowledge and documented competencies as human physical therapists in order to work on animals. And the other thing too is because this is such an emerging field, even though in Colorado with humans, we don't have to have a physician's order to evaluate and treat a person. We decided, and those three entities that I talked to, or four that I talked about earlier with the vet board and PT board, and then the Veterinary Medical Association in Colorado chapter of the APTA, that because this is a new and emerging field, we wanted to add an extra layer of safety for this process. And so we came up with the requirement that we have to have veterinary medical clearance. So we have to get the clearance and okay from a veterinarian before we're able to do physical therapy on that animal. The other thing that we came up with was some criteria and minimal competencies that have to be documented that we have to meet in order to do animal physical therapy. So in Colorado, just because we work on humans doesn't mean that we could automatically work on animals. And so what we have to do is we have to have a minimum of 80 hours of coursework above and beyond our entry level work in non-human animals. And I'll go over with you in a moment what specifically that entails. The other thing that we have to have is 120 hours of documented clinical experience with an animal PT or veterinarian. Now, note that those educational programs that I mentioned earlier, they also require clinical experience, and it varies typically from 35 to 40 hours. So you would even have to get more clinical experience in Colorado before you could practice. As far as that non-human coursework goes, there's three sections to that. The first one being foundational and clinical sciences. So things about like gross and applied non-human anatomy and physiology, things about wound healing pertaining specifically to our non-human animals, animal behavior and restraint. Those are very important to understand and know, because that's going to not only help keep your animal patient safe, but also their owner and handler safe and you safe. But particularly too with regards to animal behavior, very critical to understand that, because you're going to need to know that to interpret what is your animal patient telling you when you're evaluating them, and to also help evaluate if the treatment program that you're doing is effective and working for them. The other things that we had to learn about was zoonotic and infectious diseases. And then a second section was the examination, evaluation, prognosis, and PT diagnosis for your non-human patient. And so involving whether it's medical and conservative management of a condition or surgical management of a condition, being able to examine and come up with a plan and a rehab diagnosis was important. And let me take a moment and just delineate for you. There are medical diagnoses and then PT or rehab diagnoses. So, for example, if I have a dog that has torn its cruciate ligament, typically it's called the cranial cruciate ligament in dogs, which is anterior cruciate in people. The medical diagnosis is the cruciate tear. But the rehab diagnosis would be working on pain, edema in the joint, gait deviations, neuromuscular impairments, and strength issues. So those are the differences between a medical diagnosis and a rehab diagnosis. The other thing you have to learn too is gait analysis and movement analysis. And I can tell you, even with the years experience I have in animal PT, I still find it more challenging doing a gait analysis on a tripod or a four-legged animal compared to doing it on humans. The third thing is developing a plan of care. What is your treatment going to be and how to measure your outcomes, particularly with regards to therapeutic exercise and activities, applying them to your non-human patients, what type of modalities to use. For example, we can still do electrical stim to our animal patients in the way of neuromuscular electrical stim or TENS unit, for example. We can do ultrasound, laser therapy, manual therapy, all kinds of things that we're able to do with our humans. There are safe and effective ways that you can deliver that to your animal patient population. And then, as I mentioned, how do you assess if your program's being effective? And then also documenting on that. So with regards to the Veterinary Practice Act, as I mentioned, in Colorado, we have to get medical clearance from a veterinarian, but we don't have to have direct supervision of a veterinarian. And that's what enables me to do my mobile practice and treating these pets in their homes. But it is important that you're familiar with both practice acts because, as I mentioned, it could be in the state you live in for animal physical therapy, you might actually be governed by that state's Veterinary Practice Act. So it's real valuable to have information on both of those. The big issue that came up for us when we were working on those 3 years getting our Practice Act changed was safety, safety, safety. So again, as I mentioned before, just because you're a human trained physical therapist doesn't mean that you can automatically go in and start working on animals. And even if you're in a state that allows you to work on animals, but maybe doesn't require those minimal competencies, it would still be advisable to go through some animal rehab training program, again, just to maintain safety for your patient and the owner and handler and for yourself. Now, with regards to the training that I'm talking about, and as I mentioned before, several programs here in the United States, I'm curious to know, have you investigated any animal rehabilitation programs?
There we go.
Oh, okay. Looks like, well, we have here 78% said yes. So quite a few of you have looked into the animal rehab programs. And the nice thing is there is these variety of programs, and you can check and see what might kind of set well with you. But things that in considering doing these programs is, of course, the time and money doing it. So it's important to look into these animal rehab programs. I think that's where you can get some really good foundational knowledge for translating your human physical therapy skills into working with animals. And also, I think as a veterinarian, can get really good foundational knowledge about how to use rehabilitation techniques and thought processes if you're interested in pursuing animal rehab in your field. The other thing, too, is the importance of continuing education even after you get more formal training in animal rehab. There are more and more courses coming up, for example, like CuraCore, with some great continuing education programming specifically related to veterinary rehab. But also, too, as a physical therapist, you can take your training and CEs that you might use in the human part of your practice, and a lot of times can extrapolate what you learn in those into your animal physical therapy practice as well. But again, the best and safest way to do that is to first get that good foundational education in animal rehab itself. Networking is very valuable. I've had the fortune of being able to work not only in a mobile practice, but also at the Fort Collins Veterinary Emergency and Rehabilitation Hospital. So it had an emergency clinic as well as a rehabilitation clinic that did inpatient and outpatient rehab. And so was able, for 8 years working there, develop good collaborative working relationships with veterinarians and veterinary technicians. Learned a tremendous amount from them. So finding clinics in your community and individuals in your community that you can network with and continue to collaborate with is very valuable. And also there are some animal rehab sites that offer some audio and video type trainings. For example, like Lori Edge Hughes has fourleg.com that you can get some additional training there, just to name another example. So there is becoming more and more educational opportunities out there for animal rehabilitation. The other thing to consider is most of these programs have some online classes, which is great because you can still practice. Let's say if you're working in your human practice, you can continue to do that while you're also going through these additional animal rehab programs. And it may be possible, depending on your state and their criteria, that you can count some of this animal rehab training that you're getting towards your CEs for your licensure renewal. So it could be beneficial that way as well. Now, you would need to take some time off to do the hands-on labs that are required in these educational programs, as well as the clinical experience. As I mentioned, most of these programs have like 35 to 40 hours of clinical externship experience that you need. But again, in Colorado, you need a total of 120. But you don't have to do it all at one time. You can do it in a combination of ways and spread it out also. So there is a lot of flexibility in here, in that it could be easier to incorporate while you're still practicing in your human physical therapy profession. And sometimes a lot of people continue to do both, as I did, maintained working as a human physical therapist and an animal physical therapist for about 3 years. And I was just getting so busy, I had to make a decision which direction to go. But there's definitely physical therapists that do both. The other thing to consider is the time that you need to take off to do case studies, because these programs will require case studies, and then also prepping and doing an exam for your certification. The other thing to consider when you're thinking about, okay, I'm going to invest the time and the money in to get more training into animal rehabilitation. Now, let's say you get your education and you're thinking about what kind of settings would you like to work in. So here's to name a few. That's not all encompassing, but these are the ones that I see most commonly available. And that is in veterinary clinics. Some general practice clinics may offer rehab services. There's also specialty clinics that may offer rehab services, and separate veterinary rehab clinics that only focus on rehab. There can also be outpatient physical therapy clinics that are run by physical therapists that offer animal rehab. Universities, some of those offer rehab services, and then businesses like mine where we do home visits and have a mobile practice. So my question for you is, thinking about your animal rehab career, whether it's as a veterinarian or as a physical therapist, is what practice setting would you ideally like to practice in? We have family veterinary practice, a specialty clinic, outpatient rehab clinic, or mobile practice.
And there you go.
53% said mobile practice. 27% said a specialty clinic. 13 said family practice, and 7% said outpatient. I have to say for myself, and although I very much enjoyed working in the rehab clinic setting, being able to see animals in their home, I find very valuable and rewarding. And I think they're often a little different in terms of their temperament and behavior when you're able to see them in their home setting. Now, the next issue is the practice liability, and this sometimes gets a little tricky and murky, but still, nonetheless, you need to have a good understanding and picture of what all this involves. So, if, for example, you are employed by a clinic, then your employer might provide you some liability insurance coverage, although I would still recommend, speaking as a physical therapist, that you still also have your own liability coverage, just as an extra layer of protection. Then, if you are contracting with a service or clinic, then you definitely would need to have your own liability insurance, as well as if you had your own practice. And what makes it a little complicated is that whether or not you can get the ideal liability insurance coverage can be influenced by your state practice act. So if your state allows you to practice on animals, that's going to be a much easier state to work with getting liability coverage. If your state is governed, your practice as a PT is governed by the Veterinary Practice Act and those kinds of things, and it could make it a little more challenging to find that liability coverage. And don't assume just because you have human liability insurance that it's automatically going to translate over into working on animals. In many states, animals are considered property. So, coverage for liability for animal physical therapy may be a very small amount because the animals are considered property. So, check with your insurer if you already have some liability insurance coverage as a human PT, and see if they will also enable you to use that for treating animals. In my case, I use HPSO, which is an organization that's been used by the APTA, and I have what's called an endorsement on my policy for service to animals. The other thing that can influence your liability coverage is also the kind of animals that you work with. So, for example, if you're working on horses, and it might be performance horses or racing horses, that's a multi-million dollar industry. And so, trying to get enough liability coverage to work in that industry can be challenging to do compared to working on like companion animals. So, keep that in mind as well. But again, if you're networking, also too, some of these rehab programs can help connect you perhaps to some different sites so you can start researching liability coverage for your practice. Number 4 on our checklist, so we've gone over Practice Act issues, academic training, liability issues, and now we're looking at what's really motivating you to think about going into animal physical therapy. And this is something that I was thinking about when doing this webinar, more specifically thinking about physical therapists, but it could also apply to veterinarians. When I was first going into my animal rehab training program through the University of Tennessee, one of the first classes that I attended was in Iowa, and I remember the instructor there asking all of us attendees, and there were PTs and veterinarians there, why is it that you're coming to this class? Why are you interested in looking into animal rehab? And the most common answer was, I'm tired of working with people. Which the reality of that is you're going to still have to work with people if you're going to get into animal rehab, because the vast majority of the time you're going to be working with animal patients who are going to need to have programs done at home. And so you have to work with the owners or handlers and helping them come up with things that they can do with those animals at home to help in their recovery. So, for example, here, I have this Mastiff that I'm working with. His name is Oaf. And, oh, excuse me. He tore both of his cruciate ligaments. And that is, for those of you that don't know, that's in the knee. And so back here, we call the knee the stifle. And I'm showing her, Oaf's owner, how to make sure that the gluteal muscles are engaging while we're doing the exercise. The other thing is, with regards to education, is I would like to tell you, like in this case with Ruby, who's over here on the right side, she fractured her back and was a paraplegic. And it'd be nice if I could just tell her and show her and read to her what she needs to do to recover. But the reality is that doesn't work that way. So I came up with a program of things that her owner could do to help in her recovery. And I'm happy to say that she's back to hopping around, can get on and off the sofa even, and those kind of things. So you definitely have to continue to work with people when you're going to be doing animal rehab. Another thing, when I've had people shadow me, or even just in casual conversation, one thing that comes up often is people say, oh, that sounds like that would be fun. I love animals, and I bet you animals don't talk back. But indeed, they definitely can talk back and will talk back. And that's why it's very important that you have this good educational foundational work, particularly understanding animal behaviors and gross and applied anatomy and physiology. Is that the patients will definitely talk back to you. You just have to know how to read them. And if you're not knowledgeable about that, there's the risk in that you're going to hurt that animal. And that animal, in turn, may turn to nip at you or bite you if you're doing something that's uncomfortable. So, for example, here is Oaf, again, the Mastiff that had the cruciate tears here in his knee and his stifle joints. This is after his therapy session. This is him at home. And you can see he looks very happy and relaxed. And his reward is he gets his favorite ball there after his therapy. We have this pup here. She had bilateral patellar luxation surgery. And if you look at the look on her face, she seems like she's a little bit suspicious, a bit concerned. And so my approach with her would be different. I would approach her in a more gentle manner, spend some time getting her just relaxed, reassuring her that I'm not a threat to her. And I'm happy to say she was a delight to work with. She recovered very nicely from her surgeries. She first, for a while, I saw her a month after her surgery. She was actually just walking on her front legs, but she responded very well to therapy and had a full recovery with just a few visits, actually, of just teaching her and reassuring her it was okay to use those hind legs again. Over here, the reason I have this picture is because this is a very arthritic elbow. It actually belongs to Spree, who you saw in her cart on St. Patty's Day Parade. And I mentioned to you that she had developed severe elbow arthritis. After she passed, her owner kept some of her joints to help with educational purposes. And this is what Spree's elbow joint looked like. I mean, just looking at it can make you sore and, realize how painful that joint could be. And it's not often in our human physical therapy practice that we're going to be running into elbow joints with this degree of arthritis, whereas it might be a more common thing that we see in our canine patients, largely because they're weight bearing into their front end. So this will be, again, having that basic foundational training is really important so that you know more of what you're dealing with when you're talking about these animals' anatomy and physiology with their various conditions. And Spree, who I worked with from the time she was about 9 weeks old till she passed at 10 years old, and I would see her every week. I still had to be careful every time I worked with her and making sure that I didn't hurt her. And I learned how, and she taught me what her body signals were of things that I could do that was uncomfortable for her. And so hers were, she would sometimes turn and give me a little stink eye, or her breathing rate might change. But there's times too that if something was particularly tender, she might yelp and turn and put her mouth on my hand, those kind of things. So again, just being very conscientious. But yes, animals will definitely talk to you, and they will definitely talk back. Then another answer that I get from people, and this is part of the reason too that I think I moved even more into full-time veterinary rehabilitation, is because in the human world, we can get tired of dealing with insurance and bureaucratic red tape. And so that too, in the animal field, one of the things we find is, and this is checklist number 5, is kind of the business setup for animal rehabilitation. One thing that's nice about it is owners pay at the time of service. So you don't have big insurance companies driving your rehab program like you do in human medicine. Now, there are some pet insurances out there, and owners, because they're using their disposable income, may still opt to only do what their pet insurance will cover because of finances. But again, the insurance company isn't kind of pushing and driving and defining what you are doing in your rehab programming, which is very liberating. So, one of the questions I have for you is, have you had to deal with pet insurance, whether it's on the receiving end of it, or if you're a pet owner and your pet has pet insurance, dealing with it in that aspect? So, if you could take a moment and answer that question. Look at that, 76% have dealt with pet insurance. Okay. Typically, what I have found in the times that I've dealt with it is still often the pet owners still pay at the time of service. Then you can give them a paid invoice, and then they could submit it to their insurance company. Now, there are some clinics that are willing to help submit things for the pet owners. And that's a nice service to provide, but it can also be tremendously time consuming. So be cautious if that is a service you're thinking about offering. So, but it is very liberating still in the animal rehab world that you are pretty much able to design your treatment program and plan the way that you really feel like the patient needs. Also, just keeping in mind what is the client's needs and their abilities with regards to their skill set and time and finances. I can remember working in the human field, dealing with Medicare, and Medicare has many wonderful qualities to it. But also, they at times would go through phases where they would not reimburse for certain services. So, for example, there was a time when they wouldn't reimburse for electrical stimulation for wound care. Then the APTA and other organizations um, worked with them on that, educated them on that, and then they went back to allowing reimbursement for electrical stimulation. There was another time when they decided they weren't going to pay for infrared therapy and laser therapy. And so there were some places where if you had a client with Medicare, that may not be a modality that you could offer because it wasn't a covered service. And we don't have those kind of issues in animal insurances and animal rehab, which is wonderful. So you can see here on the left, I'm working with this cat. She has a fibular fracture and a sore ankle, which we call a hock, for those PTs that may not know that. And so I'm doing laser therapy there. I'm doing neuromuscular e-stim on this dog here, working on her quadricep muscles. And then here's Oaf, the Mastiff I mentioned. He has a brace. And so we didn't have to go through an orthotist to make the brace who had to get prior approval from an insurance company and all those kinds of things. We were able to just start right in on the process, provide this rigid or custom rigid brace in a more timely manner. And it just enables you to do your rehab programming, I think, with a bit more efficiency and also makes things more efficacious. The other thing that's nice too is you can freely design programs for the pet owners as well. And again, as I mentioned, the importance of them being able to do things for their pets at home. So, for example, here I have my dog Marley, who's sitting on a pulsed electromagnetic field bed. She's also got a special coat on for her arthritic back. And then the bandana she has on has a little pulsed electromagnetic field loop around her neck because she had a wound on her neck and it was helping with that. This little Shih Tzu over here, she had some pretty significant back pain issues as well as some knee issues. And she loved, there used to be a sofa right here at this bay window, and she would jump up on the sofa and then from the sofa on the back of the sofa and up onto this bay window. Well, given her back issues, that could be quite detrimental to her. So her owner, who is a great craftsman, made this ramp for her, made it very functional with shelving, beautiful workmanship here. And so for the rest of her life now she has this safer way of still enjoying the window seat, but keeping her back and her knees more comfortable and healthy. So I have found, again, number 6 with regards to the rewards of this job is just being able to spend time with the patients and their people being tremendously rewarding. Most of my visits, for example, are up to an hour long, and it's just me and the pet owner and the pet. And so for me, that's the kind of practice setting that I really enjoy. There's other practice settings out there that can be more fast paced, a lot of high volume. And if that's the kind of setting you would enjoy, there's definitely options for there as well. But being able to really just be a clinician and use your skills and knowledge base, I have found really rewarding and liberating. And then also looking at patient outcomes. You will see that a lot of times you'll hear clients say, thank you, thank you, thank you, I have my dog back. Where you're able to work with their animal, recovering from an illness or injury, or even helping with improvements as they deal with chronic issues, and how grateful these owners and handlers are. And also working with these patients who are so excited to see you time and time again, or they get super excited when they're in the owner's car and the owner turns into the parking lot of the rehab clinic. It's just great to have that kind of energy and dynamic there. And then working with these animals and learning how they function and what motivates them, and being able to use some creativity, but yet your evidence-based knowledge in designing programs very specific for them, really just helps for me intellectually continue to enjoy this field. And as I said, the more I know, the more I realize I don't know. So I'm enjoying, even into practicing over 30 years, continuing to learn and learn. And these outcomes with the services that you can provide. This is a case here. This is Antoine Blue. This was taken in 2012. He was under a year old. He has a Neospora parasite, which caused some deformity in his hind legs. So surgery was done to try and help deal with those deformities. The surgery wasn't successful, but he has since gone through and has a wonderful rehab team. We do home care visits as well as he does clinic visits, and we're continuing even to see him till today. So we've been seeing him for years, and the outcome for him is he is now able to walk, run. He goes out with the horses every day. He has some special braces on his hind legs, but he's independently mobile, and he has a very full and active quality of life. And to be just a small part of that for him is, again, very rewarding, very valuable. So I hope you find that in looking at really thinking about doing animal physical therapy, that you can now take some time, kind of consider Practice Act issues and liability issues. Look into these animal rehab programs and continuing education courses. Really think about what's motivating you and what's realistic with your motivation. Think about what kind of practice setting you might ideally like to work in and how it might work for you financially. And then think about all the rewards that you can get from this emerging and wonderful field of physical therapy. So hopefully you can now spend some time and answer this question for yourself: is animal physical therapy for you? And I took this inspirational quote from Antoine's Facebook page by Michelle Ruiz, and it says, "If people are doubting how far you can go, go so far that you can't hear them." So I hope you're able to spend some good time and really looking into animal rehab and join us in this profession. If you do have any questions, feel free to contact me at goodlifept@gmail.com. And Dr. Robinson also mentioned, if you want copies of this PowerPoint presentation, you can go to info@curacore.org. Thank you.
Thank you so much, Deanna. That was great. And I think that just your wonderful personality and care came really right through. And I know that everybody else will enjoy it too. So thank you so much. I'm going
Okay.
to um, change the screen to mine so that I can talk a little bit about the course that you are helping us give at CuraCore. So for those of you that are interested in our MOVE program, that's our integrative, more orthopedic type and neurologic. This is the website for that. Our website for the vet side is curacore.org/vet, and then you'd go to courses, and then you'd go to integrative rehab. And so just to talk to you a little bit about it, we have a brochure on the site, and our our integrative rehab certification program or courses are two parts for the didactic and hands-on piece. So that's the Move Ortho, which is your starting point, and then the Move Neuro, which is the next phase. And so each of those has a an online piece and an on-site piece. And here you see Antoine in the picture here, and he's receiving his rehab from Deanna and Aaron over here. And so our goals are to keep the group small and focused, and I'll go over the instructors momentarily, but it's all science-based and evidence-informed, and we call it integrative because it includes medical acupuncture, the photomedicine, some medical massage. So we include those as considerations, but those, you're not getting the full certification course in each of those, but you are seeing how all of those modalities, the massage, laser, LEDs, even some botanicals, and then the movement, the exercises, and the acupuncture would all work together. And we're focusing on three core principles. So this is where we diverge from much of the other stuff that you can see out there in terms of rehab courses, and that's borne by my decades of work in osteopathic medicine as well as veterinary medicine, and having Deanna bring her wealth of information from her decades of work in both human and animal fields. And we start out with the MOVE program and the online piece, really looking at the fascia and how it interweaves and unifies the body. And it also is spreading some of the forces that are exerted upon us. And we shift our focus from muscles as the mover of bones, and bones as the structure that we have to focus on when you think of orthopedics and radiography and just looking, okay, where are the bones and where are the joints. This is really very much a shift away from that tunnel vision to a more comprehensive approach on all the soft tissues, because movement involves the fascial, the contractile, so the muscles, but the nerves that drive them, the circulatory system that feeds them. It's the whole animal. And as you see here with this little patient that joined us back in the October session of the medical acupuncture for veterinarians course, you see this little baby has so many issues. There's not one spot on that dog that isn't needing some kind of attention. And so we're not going to compartmentalize into the carpus and the tarsus and, the TL region. We'll look at that as part of the whole, and realizing, driving home the points that successful outcomes attend to the patient as a whole, from nose to tail and surface to core. And so we find that transformative, and we just love teaching. And so for the Move Ortho, that part one, we have the online course, which is 32 hours, and that's what I'm in charge of. But we also include various videos that Deanna has recorded with her patients, such as Antoine, and that's really just stimulating. We combine the basic science with the clinical applications, and as you can see here, and this is again on the brochure that you can download from our program, we have a unified kind of curriculum. It's not jumpy and patchwork, but it goes through a very well orchestrated curricular format. And then we have the on site portion for that, the osteopathically inspired, fascially informed manual therapy approaches, and then the details on your modalities, your neuromuscular, electrical stimulation, and ultrasound, how to use the equipment. We'll talk about braces and various assessments, the myofascial, neurologic, and ambulatory. And then there's the next step, which is the Move Neuro, and that's where we're focusing on neurologic disorders, predominantly in dogs, talking about, really how do these originate? What parts of the nervous system are they affecting? How will it manifest? And whether we're talking about the brain, the spinal cord, peripheral nerves, the autonomic nervous system, how does fascia engage in the dural folds with the brain, the spinal cord, and peripheral nerves? So we're really expecting a lot from you, but we want to give a lot to you. And that is in many ways going to revise and reframe your ideas about what causes disease and how everything is connected. If we have a biceps tendonitis, throw that out, because the biceps tendon is only a victim of other forces placed upon it. And how can you separate the biceps tendon from the biceps muscle and the interdigitating, fibers that go into the bone? We're going to teach you a lot in this course. So this is neuro. It takes a different approach, but because we're looking more at neurologic things, but you still have to have the structure there. So we're scaffolding onto Move Ortho, then we have Move Neuro on site. And then 6 months after that is done, then we have a full week where you do your internship, and that's a 35-hour hands-on internship. And we really started our Move program. So when you hear the word PRIMA, that's our Pain Rehabilitation and Integrative Medicine Advantage program, and that's a certification series unto itself. But the Move part is that rehabilitation, and it's an integrative, as we said, multimodal kind of approach. But we started with focusing on cruciate disease, so non-surgical approaches to cruciate disease last year, and we have some experiences from our participants. And thank you, Jen, and thank you, Lisa, for giving us those votes of approval. For Move Neuro, we have Dr. Danny Anderson. She's a veteran with our medical acupuncture for veterinarians program as an instructor, and she has a really robust, bustling practice called SOAR, SOAR. I think it's Southern Ontario Animal Rehabilitation in Ontario. Super busy, is always hiring new people, and very, very successful. And she will be helping with the Move Neuro part. And then, of course, Deanna now, and she will be working with us throughout, and especially with the Move Ortho part. And then we have local practitioners that will also be helping with the small groups. So, leading the way again, we do not copy others' programs. We take our own expertise and we see what needs to happen. We fill the gap that is currently existing within veterinary medicine. I feel like we're not there yet with what has been offered with rehab. it's really important to go to that next level and get a much deeper understanding, go beyond the modalities, go beyond the compartmentalization, see it as a whole. And that's where we are filling that gap. So multimodal, multidimensional learning, non-surgical, integrative rehab, surgery can wait. Let's get that animal better to the best that we can. It's not an emergency to do a TPLO. And actually, I won't get started on the TPLO, but anyway, the role of fascia in movement, more complete and accurate diagnoses, using your hands, bringing back that lost art of the physical exam, innovative and fun curriculum, because we're fun and we love to learn new things and teach new things. And then that's part of your PRIMA certification requirement. So let us know how we can be of service to you. info@curacore.org. We really appreciate you joining us, and you'll be hearing from us again. And next week, we'll continue our Wednesday webinars at high noon in the Mountain West. Take care.